y'all hear me? Yes, good? You can hear me? All right.
I know you have to speak into it.
Oh, okay,
That's what.
I'll get a little closer. I might have to hold it. All right. Good afternoon. Thank you, Mr. Roger, and thank you to the AIC board for...
You're good.
I'm good? Okay. For allowing us to present. I think we were at the September meeting last year, so almost a year. So last time we talked a lot about what was in need of repair, what was broken, and kind of what was wrong at 1125 Marguerite Street. And today I want to spend a little bit of time telling you about what's right at Ochsner St. Mary, which is located at 1125 Marguerite Street. The next slide, I'm going to talk a little bit, and don't worry about HIPAA. I do have permission to share this story. And all of our leadership meetings and our board meetings, we start off with either, a little closer, start off with either some good news or we start off with a patient story. So this is a patient story that I really think illustrates what we are about as a community hospital. So this patient was a lady from Conroe, Texas, who had been given a terminal diagnosis within a few days prior to her arriving in our emergency department. Her daughters drove her to the community from Conroe because one of her last wishes was to be able to meet Troy Landry. So they drove to Duffy's, and Duffy's was closed when they got there. So they checked into an area hotel in Morgan City, and unfortunately she coded at the hotel room on this particular Saturday morning. So our Acadian ambulance partners brought her into our emergency department. Our ER medical director happened to be on duty. His name is Scott Domingue. If you haven't met him yet, he is phenomenal, technically competent, and just really a huge heart. And so he wound up intubating this lady. The family members, the two daughters who were present, told the story of what they were doing in the community. And so the nursing staff, along with Dr. Domingue, made about 1 or 2 phone calls. And then, as you can see here, Troy Landry was kind enough to stop by on his way to work that morning and grant this lady's final wish. So this family was just, over the moon by what we were able to do. And I wanted to highlight, what our staff does. Again, technically competent, but huge empathetic hearts that really, they love what they do, and that they were able to make a difference in the life of this lady who sadly was transferred back to Baylor, which was where her oncologist was, and she did later expire. But this family has written us thank you notes, has texted Dr. Domingue just to say thank you so much for granting her last wish. So just wanted to highlight that. Next slide, a little bit about, I think I am going to have to hold on to this. A little bit about the system that we are part of. So Ochsner Health is 40,000 team members, about 4,700 physicians and advanced practice providers. We also employ approximately 10,000 nurses across the state of Louisiana and Mississippi. The next slide highlights all of the locations across Louisiana and Mississippi, and then it kind of talks about those that are owned and then those with financial integration. We are part, as Ochsner St. Mary, we're part of what we call the Bayou region. So, of course, Ochsner St. Mary in Morgan City, Leonard J. Chabert, which is the facility in Houma, which is largely a teaching and charity institution, and then Ochsner St. Anne in Raceland is a critical access hospital in that community. Furnace LeBlanc here, Wade Furnace, is my boss and the regional CEO for what we call Ochsner Bayou region. Next slide. I wanted to spend a little bit of time talking about quality and patient safety, because that is really the heart of what we do. As a healthcare organization, you want to make sure that you have a very safe institution and a highly reliable healthcare organization. So the first part of the slide is to focus on Joint Commission. So Joint Commission is an accrediting body, so they accredit hospitals. Been in business since 1951, and so every hospital across the United States has to have some type of accreditation. Joint Commission is pretty much the gold standard in hospital accreditation. Hospital accreditation not only says that we are a safe institution and that we are focused on the care of our patients and continuously improving, but it also allows us to participate in the Medicare and Medicaid programs that are sponsored by the government. So really important to what we do. We did have, we get surveyed every 3 years. It's an unannounced survey, so they just come. We know kind of about the window, but they did come to our hospital 2 weeks ago, and we had one of the best surveys that we've ever had in my history of what I do, and definitely Ochsner St. Mary. So really proud of that. The other thing that we're really proud of is the leapfrog designation. So for the past 3 reporting periods, we've gotten an A grade from the leapfrog group, which is another nationally recognized group that really looks at the quality and patient safety provided by healthcare organizations, and then that information is publicly reported so that as a consumer you can go out and see, like, okay, who's providing the best care, and obviously an A grading really recognizes that excellence. Let's see, what's next? Okay, so busy slide, but I did want to kind of talk about some of the services that we provide both as a hospital and then on the outpatient side as well. So again, anesthesia services that go alongside our surgical services. We have, as I mentioned, 24/7 emergency department. We see approximately 25,000 patients in our ED each year. Full service lab radiology. We also perform dialysis on an inpatient basis, not as an outpatient, but we do perform inpatient dialysis. We have a telestroke program which identifies, early stroke symptoms so that we can get patients to the appropriate level of care. Teleneurology, again, that's a service we'd like to grow upon and have actual neurologists present, but for now we have the telemedicine product there. Really proud of the inpatient rehab department. So that's a department on our 7th floor. It's a 10-bed unit. So if you ever have the need or a family member that needs inpatient rehab facilities, our program is really top-notch. I know this not only because I work there, but my dad's been a patient for the last 10 days. So really proud of that group. And then, of course, psychiatry. So we have an inpatient behavioral health unit also on our 7th floor. That's a 15-bed adult unit, and it stays full. And then most recently, we've added some pulmonology services, and I think I'll talk about that on the next slide. And then you can see a whole host of outpatient services, diabetic education, infusion services that we provide on the 5th floor of our hospital. We have a sleep lab. We have endocrinology. We have a partner with wound care that comes to the hospital on Tuesdays. And then also, last but not least, I wanted to highlight that we do also do outpatient physical therapy, occupational therapy, and speech therapy. Upcoming services, I know Bill's going to talk a little bit about this, and Dr. Tenney's here, but ENT services starting in the 3rd quarter of this year, really excited about that. We haven't had that since Ochsner took over. And then also in the 4th quarter of this year, we'll be having gastroenterology services. So we'll have 2 nurse practitioners that come each on alternating days of the week, so 2 GI days of the week in Morgan City. So really excited about that, and that's 4th quarter. Next slide. I wanted to highlight the employed docs. And so it goes without saying that this is not our entire medical staff. In addition to these providers, we have 9 additional community docs that are in private practice. But these individuals and then those 9 docs make up basically our full-time medical staff. So Katrina Castile, general surgeon, she came to us from the LSU Shreveport program where she was chief resident, Yale undergrad, wonderful, wonderful surgeon. So if you need a surgery or if it's time for your colonoscopy, she's your lady. Chandler Pasqua is the nurse practitioner that helps support Dr. Castile. Chandler also helps out in our wound care clinic on Tuesdays. Marcia Blero came aboard as an employee when her dad, Dr. Blero, retired, so she's been with us, I think, right about 2 years, family medicine. Julie Price and then Brittany Corso are our OBGYN providers. So Julie is still in Morgan City, full-time, 5 days a week. She's seeing obstetrics and gynecology, and then Brittany is a midwife who's helping support those obstetrical clients. and then, making sure we have a smooth transition so that those individuals can deliver at our Graceland facility, Ochsner St. Anne. Glenn Longclose is orthopedic nurse practitioner, full-time in Morgan City. Ashley Dufresne does outpatient behavioral health or outpatient psychiatry services. She's here 2 days a week. Dr. Sarmiento and then Adele Pizzolatto both do endocrinology. So full-time between the two of them, they alternate full-time days in Morgan City. Dr. Saltzman is urology. He's here on Mondays. And then, as I mentioned, I'm going to call him Dr. Ugo because his name is really hard to pronounce. But he is our most recent addition, and he's providing pulmonary critical care coverage. So mainly our patients in ICU who are intubated, he does consults on those patients. So really excited about him and the level of service that he's providing to our ICU. What do we have next, Gil? Okay, so a few things about investments that Ochsner's made. So one of the first things Ochsner did was improve our electronic health record. So we are on Epic, which is the largest electronic health record vendor in the U.S. Approximately 1/2 of all U.S. hospitals use Epic. So what that means is you can download this fancy app on your phone, and if you utilize our services, all of your labs, all of your health information is readily available on that app on your phone. So it also helps to integrate. If you go to any other Ochsner facility, you can have all that information. Your providers can see all the care you've had. And then, as I said, with close to 1/2 of the hospitals in the country on Epic, if you travel, you have all that information, and the providers will have that as well. Let's see, what's next? Okay, I wanted to talk a little bit about security investments because that was another thing that was really a focus. When Ochsner first took over, we had about 9 full-time security guards. We now have 19. So that means approximately 2 to 3 security guards on every shift. 15 of those are armed officers, and then we have 4 unarmed officers. So largely, like a, what do you call it, police type background, so a lot of training with that. We added security cameras, locking mechanisms where you have to have the badge access into certain areas. You can see the what we call the strong line panic buttons, that picture up there. So in our high-risk areas, such as our ER, our behavioral health unit, all the staff members have a panic button that goes straight to the security team so that they can provide assistance. And then also the Evolve security scanner is at our ER entrance, so that is checking for contraband, weapons, knives, guns, those types of things to keep our patients, our employees, and our visitors safe. And then lastly, I wanted to mention that Ochsner was really instrumental in a law that was signed by John Bell Edwards right about 2 years ago, which makes violence or threats of violence against a healthcare worker a felony. So we work really hard with our staff members to, really voice if they are threatened or, I had, unfortunately, I learned this morning that at another institution, someone spit on a physician, so those types of things aren't allowed anymore. It used to be that, we just kind of said, oh, well, the patient's in a crisis. Well, yes, they're in a crisis, but you still can't, commit violence against a healthcare worker. And now that's a felony, potential felony conviction. Another big focus of ours has been on recruitment and workforce development and getting folks to come back to the community to serve our patients. So alongside the HSD, which Bill's going to talk a little bit more about this, we really focused on physician recruitment to include primary care and then specialty such as neurology and then really orthopedics. Those are kind of our, top of our wish list. ENT services starting in the 3rd quarter. Really proud of our Fletcher partnership. So Ochsner donated about $1 million. I guess it's going on close to 2 years ago to expand nursing and allied health programs at Fletcher. So we participated in a ribbon cutting, that's the picture down below. Last year, they built an 11,000 square foot facility to really expand their access. So they're tripling their ability for enrollment for both nursing and allied health. So we've had a really good nursing pipeline. The next thing we're focusing on is radiology. We have lots of needs in our radiology, so rad tech, CT, ultrasound, that type of thing. So we're helping them with that program. SOLA CC, which is the campus here in Morgan City, SLCC is what they used to be known as. the Young Memorial Campus. We have a partnership with them for an LPN apprentice program. So individuals in that program, we, Ochsner St. Mary, pay them a full-time salary while they're in school. They also have a portion where they come and do some shadowing at the hospital, and then they are obligated to a 2-year commitment once they finish that LPN program. And that's a picture of two of the folks that at their pinning ceremony from our first cohort. And then I'm really excited about the MAP, what we're calling the MAP, or the Medicine Apprentice Program, and I'm hopeful that this pays off benefits a little further down the line. So in conjunction with the Hospital Service District, and Bill's going to talk a little bit about it as well, we're doing a cohort of 3 individuals where we're focusing on recent undergrads in the community that want to go to medical school, either medical school, so MD, DO, or they want to go get their PA. And so it's a cohort of 3. We pay them for a full-time job, and so we partner them with our physicians in our clinics, and they're trained to be an MA, so a medical assistant, so they can take that certification with them wherever they go. But the idea is that they get some exposure to healthcare locally, and they choose to come back here when they're finished with their program. So I'm happy to say we have hired those first 3 individuals. One is interested in rural medicine, which is us. Another one in ENT, and then the last one is interested in orthopedics. So great. So we're really hopeful that that just kind of builds a partnership, and that they see, that we do good medicine, and that, come back to your hometown. So again, not going to have dividends tomorrow, the next day, but hopefully long term, we'll see some folks come back from that. I don't think I saw Dr. Cephalou, but years ago he pushed a stretcher for radiology, and so him, Dr. Metz, those are local guys that came back to the community. So we're hoping for the same type of results with this program. Next slide. And now I'm going to turn it over to Craig to introduce himself.
Good afternoon. How y'all doing? My name is Craig Gia. I'm the AVP of Operations for the Ochsner Bayou region. As many of y'all in this room know, St. Mary's is dealing with a lot of infrastructure issues at this time. And it's not just unique to St. Mary's. This is a unique situation that happens across the state and also across the country. A lot of the hospitals in this country are been built in the 1970s, 1980, and not many hospitals, new hospitals are being built. And we're dealing with a lot of aging infrastructure, envelope issues, and pressurization issues. And when it comes to, I guess, equipment in a hospital, if it comes to replacing an HVAC system or replacing a CT unit, most of the time the CT unit is going to get replaced. A lot of the infrastructure and the facility equipment is kind of sometimes put on the back burner just because it's something that you don't see on a daily basis. The things that people see is the things that a lot of times the hospitals replace, and the things that the capital infrastructure money goes to. So, like I said, what puts St. Mary's a little bit different from some of the other hospitals, a lot of this infrastructure is all having to be replaced at once because of the age of the equipment. And of not replacing it when it breaks, is kind of putting a Band-Aid on it and fixing it and going on. Some of the major issues we're dealing with are deterioration of the building of the envelope, also the pressurization in the hospital, and the aging of the infrastructure. When it comes to the envelope, I guess it's almost a 3-tier problem. We have a problem with the brick, the mortar is deteriorating. We have the windows, which the sealing around the windows is deteriorating or missing altogether. And we also have, which we call the vapor barrier behind the bricks, that either deteriorated or is totally missing because it was removed in past projects, or when they made repairs, they didn't put it back. So basically, we're missing if water got through the bricks, there's no barrier to stop it. So it went straight to the insulation and straight to the sheetrock, and basically you have water issues. What compounds that issue is the pressurization issues we're dealing with. The pressurization issues, it's a problem that just doesn't happen overnight. It's a situation where you have HVAC systems that can't keep up with the hospital anymore. Either you put new equipment in the hospital, or you add on to the hospital, and you didn't check the pressurization, or you didn't fix the pressurization at that time. And as systems get older, they can't keep up with the pressure. So basically right now, the hospital is negative. It's about 25,000 CFMs negative, where a hospital should be positive. When you walk into a hospital, you should have a cold air hit you in the face, not when you walk in a hospital with a hot air hit you in the butt. Pardon my language. But what that causes is the hospital sucks in moisture. So as we're fighting the vapor barrier that we have, the problem we have, it's also bringing in moisture into the hospital because of the negative pressure of the hospital. And also, like I said, with all the HVAC systems, most of the HVAC systems we have, the newest one we have is probably 2018. All the rest of them are from the 1980s, 1990s. As I know, if y'all passed the hospital lately, we're doing a lot of measures to take care of a lot of these situations. If you notice the hospital, if you pass by lately, it's being painted. It's not only just a paint; it's a water barrier. It's basically a rubber coating. It's a silicone-based paint that's going to seal the building. Since we don't have an interior vapor barrier, we're going to make an exterior vapor barrier. And at the same time, we're fixing the pressurization by installing 4 new fresh air intake units on top of the hospital to push fresh air into the hospital to make the hospital positive, so we can stop the condensation issues in the hospital. And at the same time, we've been working with local engineer firms to come up with a 6-year plan to replace all the rest of the infrastructure. Also working with HSD to kind of work on the fast forward plan. So as soon as we get this plan, not only is it more energy efficient for the hospital, but also it fixed the condensation issues we have in the hospital, where basically the hospital for years been kind of deteriorated from the inside out. Because that's when you have condensation issues, not only is the pipes, I guess, rusting from the inside, but also rusting from the outside. So we have serious issues with chill water pipes, hot water pipes that we constantly have ruptures within the hospital that we fix on a daily basis. Here's, I guess, a list of series of projects we took on over the past 2 years. Since Ochsner took over the operations of the facility back in 2019, Ochsner has put over $15.3 million back into the hospital for its investments on infrastructure for us, like Jennifer talked about, security, IT, investments into equipment. Also, after Francine, the renovation of the hospital after Francine. As of right now, on this 6-year plan, we're looking at, in the future, we're looking at another $12 to $14 million worth of equipment we need to replace in the hospital. And also a permanent fix on the exterior of the envelope, which is probably another $10 to $12 million to replace the windows, fix the structure of the building for the bricks, and all the other issues we have in the building.
Okay, I'm going to try to speed up in time for Bill and questions. So a little bit more about economic impact. So our salaries and benefits for St. Mary staff and providers last year, 2024, was $24 million. So we employ approximately 250 full-time, part-time, and as-needed staff members, which generates approximately $95 million in regional economic benefit. As Craig mentioned, approximately $15 million in facility and equipment improvements since 2019. Last year's parish and state taxes were $432,000. Local vendors in St. Mary Parish that we do business with, $3.7 million. And then the value of services provided to underserved populations, such as the indigent charity and then Medicaid, is valued at $81 million. All right, and then something else that we're really proud of, our vision as Ochsner system is to inspire healthier lives and stronger communities. So we've done that throughout a cooperative endeavor agreement with the Hospital Service District. They help support some of these community events that we've done. So comprehensive health screenings, flu vaccines, lots of educational opportunities. We've also partnered really strongly with St. Mary Parish Schools, so we help support some of their career days, their health classes. Our leaders give presentations during those events. Some trunk or treat, Christmas on the Bayou, that we focus on the kids and getting them into the hospital and kind of showing them what we are. We've also hosted for the past several years a Safe Sitter class where some of our RNs teach young adolescents in the community, boys and girls, how to safely care for children if they are babysitting. And the picture up there is of our last class. It was about 3 weeks ago. And then also one of the events that we've done annually is a breakfast with the docs, where we invite high school juniors and seniors who are interested in a healthcare career. And we have a panel of our local physicians where they give a presentation, talk about their journey into the medical field, and then allow an opportunity for the students to ask questions. So that's that second picture there. Very well attended. The kids are always engaged. So again, another opportunity for them, to get exposure to us and potentially choose us if they do go into a healthcare career and want to come back home. And then another partnership with AARP. We've done some yoga classes for them. A Heck of a Summer program is another program that the school system helps support, where kids who are interested in a healthcare career come during the summer and spend about a month with us, and they rotate throughout each of our different areas in the hospital and the clinics. And then lastly, we've recently started partnering with local business and industry to do some health screenings on site at your facilities. So if anybody is interested in hearing more about that, I'm happy to share that information. Next slide, Kelly. Oh, and then I'm wrapping up. So I wanted to share that this year we're doing what we call our second annual Roo Rumble. So it's a gumbo cook-off, and it's also a walk for the Alzheimer's Association, and we're going to host that in Lawrence.
Thanks. Good afternoon. Again, I'm Bill Bourgeois, attorney for Hospital Service District Number 2. We had our Vice Chair, Angelina Mercado, here. She had to depart. Dr. Bill Cephalou wanted to be here, could not make it. We have Ms. Jackie Sheremy here. She is our Secretary-Treasurer on the board. And those three, I suppose, are the brains behind the operation. They work really hard. It's good to be here and to report to you. We're a lot better off today than we were last time. We had the election December 7th, 2024. We asked for 9 mills for 10 years. It's going to generate about $3.4 million per year. And we had overwhelming response. 70% yes on this. We were told by our PR firm that this was one of the highest they'd seen in their years of doing this kind of work. The referendum text for the election, we tried to make it as broad as possible. And as you can see here, we want to be able to improve, maintain, operate, support other healthcare facilities in the district, repair the hospital, acquire equipment, otherwise support the provision of services. So we want to be able to recruit, we want to be able to do really be flexible and adaptable and basically take care of business. And so that's why we did that with the referendum. We have been getting an annual facility assessment using architects that are specialized in healthcare facilities. We also have an engineering firm that Ochsner uses. We've been working cooperatively and having them go over really on an annual basis the facility. This to kind of give you an example of what the index looks like. They go over the whole facility. I mean, floor by floor. They have pictures. They have really done an outstanding job in working closely with Ochsner on this. They put together a matrix every year for us, and they talk about what needs to be done this year, next year, over the next 5 years, what you're going to have to do, and it's very detailed. And as you can see here, some of the work is in progress, some has been completed. We have more stuff on the way. We have the air handling units that we're funding. We did that on an emergency basis. There was like, Greg, a 6-month lead time. So we had to have them on order to be made, to be delivered. That's in the works. And so we have a total here, roughly $27 million. The biggest part, and this was a contingency, we have the envelope of windows replacement at $20 million. What we recently decided to do in sitting down with Ochsner, working cooperatively to get as much done as we can, given where we are, is we've extracted the envelope and window replacement because we're taking care of that with the elastomeric coating. And we have roughly, that leaves on the order of $7 million. We're waiting on some numbers from the engineering firm, and we're going to basically get as much done as we can now. So we've got a timeline from bond counsel We're going to present to the board a request for funding at our September meeting, start the process. We're going to go to the council after that, bond commission, everything else. We hope to have money in hand in November. So even though the tax proceeds from the election don't come until the end of the year, we've been working all year on all sorts of things, and this is one of them. So we can hit the ground running and have funds at hand in November and really knock out all this stuff that we can and move on. Really pleased with how the building looks. Jennifer sent me this, texted me this, I guess right after it started, and you can see over on the right half, it almost looks photoshopped, where the elastomeric coating is. Of course, it looks better than that now. It's a lot farther along. When's the estimated completion for that, Greg? You know?
October. The tower will be completed by August 31st.
August 31st,
Yeah,
tower?
total
Okay.
project's about 75%.
75% complete to date. Okay, and then we have another project. So we observed some cracking of the bricks, and I don't have a slide, but if you see the ambulance over to the right there, that overhang, it's stucco. The original overhang here is brick. The original overhang in the front entrance is brick, and there's some cracking in the brick. So as a safety precaution, we had structural engineers look at that. We're having that replaced. We had architectural drawing. When's notice to proceed? Did they announce it? August 18th, notice to proceed. So they're going to get started. We thought it was going to be today, but they had some issues, and so anyway, it's about a 60-day project, and they're going to get that front entrance overhang replaced. And so we are really making a lot of progress on these projects. And then some of you that maybe have been in other presentations heard me say in December, I was at a seminar in Baton Rouge, and I saw this slide at a health law seminar, and it was pretty sobering to see the market conditions nationwide and how we've got physician shortages, and they're expected to get worse. And rural areas and primary care, is the worst area, and that's unfortunately us. So we got busy working on this, and if you want some more information on this, anybody's interested, I went and got the source material, but this is where it came from. This study, and it's it's factual. So we got what's called a provider needs assessment done. Bayou Bend had done it. It makes good sense to get a provider needs assessment. And basically what you do is you look at the market, you look at the population, you look at the demographics, you look at the physicians you do have and their ages and all of that, and you figure out what you need. Define the study area, analyze it, you profile the medical staff, determine the supply, identify the need, and you put together a report. And there are these companies that specialize. Sutherland Cotter is one, and they have very good data on, given the size of the community, you should be able to support X number of physicians. And promise to the community is, we want to have as many medical services here locally as we possibly can. So these are the results. And it's sort of hard to see where you are, I know, but if you just look at the red column, that's the surplus deficit. Red is where there's a deficit. So if we come down to the third row, internal medicine, we've got a deficit of 6.86 FTE of physicians. So we have shared this with Ochsner St. Mary, and we're going to be working to address everything that we can possibly address to take care of the community and collaborate with the hospital. And really anyone else to take care of things. We started scholarships. As Jennifer mentioned, we want to cover all the bases. And the legislature has set up a statutory scheme for both medical and nursing scholarships. This is an example of one statute that's on the books. And so the hospital service district has enacted policies and procedures already to offer scholarships, both medical and nursing and allied health. We have talked and invited over to meetings, people from Fletcher, from South Louisiana Community College. We just had ULL's Dean of Nursing and Allied Health, Lisa Broussard, over. We've had the school board folks and the Allied Health departments from Patterson, Berwick, Central Catholic, Morgan City High come over. We've given them documents, made them aware of our scholarships. We want everyone to know, look, if you're here in town and you got somebody who wants to be a doctor or nurse and stay in the community, we want to help. We're here to help. And so we're moving right along with that. This was, I believe, Fletcher's numbers. I mean, it's really not that expensive to get someone educated in some of these allied health profession areas. I mean, look at this. $12,000 for some, 13, 14, and so we can get allied health people trained for the community, and it's not very expensive. Jennifer mentioned she came to us about this medical apprenticeship program that they have in New Orleans, and thought it'd be a great idea for here. We okay, great, let's do it. Let's get some people here that want to be doctors locally, get them enrolled. We'll take care of it. So we're moving forward with that. And then just recently, you may have seen the press release that came out last week. The hospital service district, saw that we had a need for ENT services. We met with Southern ENT, they're the premier ENT providers in the region, and we said, how can we help us provide more services in the community? And we had some very productive meetings. We have Dr. Justin Tinney here with us today as a representative of Southern ENT, and we helped them with some equipment. They have recruited a doctor to the practice. He's coming on board, Dr. Patrick, mid-September. And, we're going to have 3 full days of MD providers here in the community, and they're going to start for the first time in many, many years doing surgeries at Ochsner St. Mary. So we funded the provision of some surgical trays. They need surgical supplies, surgical instrumentation, and that sort of thing. And it was a very easy lift, and they're happy, we're happy, the hospital's happy. We will not have to travel, to go get ENT surgeries. And they're going to also provide some on-call coverage. And so, like we said before, our ultimate goal is to provide as many as possible commercially reasonable medical healthcare services to the community. That's a promise, and we're working to keep it. We want to take care of the facility. We want to continue recruitment. We want to make sure everyone knows about our local providers, the importance of supporting our local providers, and we're busily working behind the scenes as we speak to get more services here to the community. And so if you know of someone who is going to medical school, is in a residency program, come to us. We'd like to reach out to them and invite them back to Morgan City if we can get them here. We want to potentially help out financially, So this is an all hands on deck issue to get physicians to our community and to serve the needs of the community now and into the future. And so we appreciate your support for the hospital service district, and we're working to keep our pledge to take care of the HSD as best we can. And with that, I'll open up for questions. Bo?
Bill, on the bond issue, what is the amount of bonds you're issuing, the term, and the estimated annual debt service?
So that's a great question. I have not seen what Jason came up with. We have we have bond counsel and we have a municipal advisor already retained. We've got drafts of documents ready to go, but we were waiting on really the market conditions at that moment, and we were waiting for a final number from the mechanical engineers on some of this. So I don't have that yet, but I'd be happy to get it to you as soon as we get it. Anyone else? Anyone? Thank you. Thank you,
Thank you very much.